So when we consider non-drug treatments, I will look at the reasons we might want to do that, and then we will briefly summarize the different options, and then expand on those perhaps later in the question and answer session. But for many people, they just have a personal preference to not have medications because you may be sensitive to them, you may have side effects, you may be taking medicines for other conditions, and adding migraine medicines to those might just create some more side effects. Some people get this concept of, or this symptom of a brain fog because they have so many medications to take. So those might be some reasons, as well as sometimes the medicines just don't give enough benefit for migraines, and you need to supplement it with some other options. So medication overuse headache, this is another reason you might want to reduce medicines. This is the type of headache you can get if over time you take too many painkillers, and that refers to too many days of painkillers in a month. And it can just blur things and give you this almost daily headache that never goes away. So for people who experience that, they look at ways of reducing painkillers and other medicines. I would say briefly at this point that keeping a headache diary is really important. It's very helpful when you look at your own pattern and symptoms, and also if you're using treatments and different things, looking for triggers or looking at the pattern over time, over different seasons, you can see how things change and maybe things that might be helpful or not helpful. And it shouldn't be something that's very difficult to do each day. If you simply put down things like when you have migraine, how severe it is, maybe on a scale of 1 to 10, and whether you took a painkiller, and that is very helpful when you go to a clinic or see your GP, for example. So moving on now to the different types. So the first one I've listed is triggers, and we often hear about triggers, but it's really quite important. It's probably one of the few things we can do to prevent attacks. We can't prevent all of the attacks, and it's worth remembering that there is no cure for migraine. So from time to time, even people with very good control of migraine will continue to have a few attacks. What we want is to reduce how often they happen, and we will look at some common triggers soon. Hot and cold packs, people find helpful when an attack has already started, particularly if you use them early. There are some over-the-counter preparations, but you can use just very simple at-home cold or hot packs. The supplements, we will look at the dosing and which ones there's evidence for. Exercise is one to consider because it can have benefit, or different types might make things worse. We look at things like relaxation or cognitive behavioral therapy as something that's adjunctive and that can be helpful either in combination with other treatments or on its own. There are some non-invasive devices. Some are approved in the UK, some are not, but they're a very interesting option because with devices, you don't have a drug entering your body, and the side effect side of things is really quite favorable. There's acupuncture, which for some people can be helpful. Again, it's without a drug, but you'd have to be able to tolerate some needles. And those are the main options we would look at today. So overall, even before considering which to select and which might be more suitable, there are certain ones. So when thinking about a device treatment or a supplement, you'd want to consult your doctor first, because there are some issues around getting the dosing right, making sure it's safe for you, depending on what other conditions you might have or how you've reacted in the past to different things. And acupuncture as well, being sure that you've got somebody who's reputable, or for example, if a lot of acupuncture is offered in pain clinics. So you want to be referred to a place that's set up to provide the service, so you're more likely to get a good response. And everyone should be, with migraine, should think about how you manage triggers and keep your lifestyle and everyday activities regular. With exercise, it can be, in general, exercise is good because it helps you to release endorphins, which have a pain-killing quality. So that's very good overall. And if we maintain good general health, for people who need to take medicines like triptans, for example, it helps you to keep a healthy heart and blood vessels, which is needed for all of these treatments. So exercise, on the other hand, if you've got other musculoskeletal problems, you might want to see a physiotherapist for some advice, or your GP, to know what might be safe, what might not be safe. It may be that simple stretches are helpful for neck and shoulder tightness that people with migraine often get. So that's one to consider if it's suitable for you, and then to do a level that's tolerable. Cognitive behavioral therapy it's a talking therapy, and it can be very helpful for a range of conditions, and especially for something like migraine, where it's long-term and it can last for a number of years. It has this huge impact on so many aspects of life, activities, work, being able to plan, not plan, having treatments that don't always work. It can, the condition itself can cause a lot of anxiety and distress, and a cognitive behavioral therapist helps to stratify all of these different issues. They help you to talk about ways of managing things better, not seeing the condition as much as a barrier, and looking at ways in which you can introduce more of the activities you want to do. Also, they look at pacing activities, so things aren't all crammed into days when you feel well and then you feel like you have extra fatigue because you've done too much. So it's like having a coach who guides you through managing the overall condition. And just coming they tend to be very common. I'm sorry if there was a muting. I'll just repeat the trigger part. So the common triggers, sleep and stress, are very, very common. Some people have hormone fluctuations that trigger migraine, so around perimenopause, menopause, period times, for example, in women. Skipping meals, which causes a sudden drop in blood sugar, can be a trigger. Dehydration might be, and for some people, weather change, and for others, the amount of caffeine, alcohol, or even certain foods can be a trigger. But it's worth remembering also that it may not be a single trigger, but a combination of these happening together can make someone who's susceptible to migraine develop attacks. But in general, we find that often migraine affects your sleep. So getting the sleep right is a real challenge for many people, but it's worth thinking about how you can best manage that. And stress, to some degree, we can control, but not totally. So it's worth just stopping and thinking about which triggers might affect you and how you might be able to address that. Keeping activities regular as a general rule for migraine is what we suggest, and it tends to work best for the migraine brain, which doesn't like change in general. There will be some other triggers that are less common, and if you do notice a trigger that's particular for you, then obviously if it's possible to avoid them, then you can. If not, it might be that you adjust other times, other aspects of your life, for example, how busy you plan to be, how many activities you plan around that time, just so you're less susceptible to developing an attack. Another point about caffeine is some people have caffeine during their work week, but then they don't at the weekend. And that combined maybe with sleeping a little more at the weekend than the rest of the week can trigger an attack. So it's worth keeping all of those things around the same time. When we think about dietary supplements, the main compounds that have evidence for helping migraine, actually working as a preventive, are riboflavin or vitamin B2. The dose that's recommended is up to 400 milligrams per day. For magnesium, they recommend an easily absorbable form, for example, magnesium citrate, up to 600 milligrams, but it can have a laxative effect. So you'd have to think about increasing it gradually and just sticking to a dose that's tolerable. And coenzyme Q10, the suggested dose is 150 milligrams per day. So all of these tend to increase the availability of energy in our cells. And in so doing, they somehow help migraine. And they have a preventive effect. They tend to work better for people with less frequent attacks, so episodic migraine. Often with chronic migraine, it's probably more helpful in combination with medicines. And moving on to devices, in recent years, we've seen some non-invasive devices which have been shown to be quite helpful for migraines. So in the UK, we have NICE assesses medicines as well as devices, and they have looked at single pulse transcranial magnetic stimulation. It's approved for treating migraine with and without aura. Kefali device, supraorbital nerve stimulation, is also helpful. You put some electrodes at the front at the start of an attack. With the single pulse TMS, the device is placed at the back of the head for a few seconds to deliver these electrical pulses. They are, however, not funded on the NHS, and this is why there's very limited use in practice in the UK. But they are, it is possible to have them either with Kefali. I think you buy them for set periods, and with single pulse TMS, if it's prescribed by your neurologist or headache specialist, you can have it on a rental basis, and you'd need to refer to your specific clinic to look at whether they would recommend it. With non-invasive vagal nerve stimulation, this is actually a treatment used in the US for migraine as well, but in the UK it's approved for cluster headache only and tends to not be prescribed for migraine here. But it again has some evidence for working in migraine, just not approved here. And again, the NHS doesn't fund it unless it's used in cluster headache. So there are some other new devices coming along as well. Some already being approved, have already been approved in the US. So there are things like an armband. There's a headband that stimulates the nerves at the front and at the back. And overall, what all of these devices aim to do is to stimulate various parts of the trigeminal nerve, which is a sensory nerve, and it's the nerve where the migraine pain travels from deep within into along the nerves, and you feel it in different parts of the head, face, jaw, as the nerve branches throughout the head. So these devices look at stimulating those nerve branches in order to dampen down the pain signals, so therefore you feel less pain. And it does that without delivering a drug, as we said before, so that makes it much lower on side effects and doesn't tend to travel throughout your body as a tablet would, because it doesn't have to enter your bloodstream. And acupuncture, this was looked at some years ago by NICE, the National Institute for Care and Excellence, who look at treatments for various conditions. They they said to consider it. So on that basis, it is possible to get a referral to a pain clinic where it's offered and have a set of treatments. And they had suggested up to 8 to 10 treatments. In practice, people who found it beneficial thought it was beneficial for the period of time that they were having it, and weren't sure if the benefit carried on beyond that. But it may be an option for people who need a break as they are using different treatments or moving from one treatment to another, or need to come off medicines, for example. So it's something to consider with your doctor as well. And cognitive behavioral therapy, you can have a GP referral to a cognitive behavioral therapist as well for migraines. And those were the main areas I wanted to cover. And just to say also that if you have any questions or need additional information, the Migraine Trust has a lot of information. We update the website with new treatments and treatments that are approved, and also have a helpline should you want to contact us, weekdays, Monday to Friday. We don't have a clinic and we don't offer medical advice, but we can provide information that you can discuss further with your specialist or GP. And with that, I will thank you for your time and attention, and happy to take some questions.
Thank you, Ria. That's been really, really informative, and it's great to see the information that you've given. So we have had some questions that were submitted prior to the event. The first one I have here is, are you able to provide the recommended dosages for supplements for children? This particular person's child is 13 and they find they're always guided to medication, but they would like to try non-drug treatments where possible.
Yeah, for children, as it's difficult with the dosing, and it's very much individualized because they need less than the adult dosing. However, depending on the age of the child and other conditions they may have, the doctor usually individualizes the dosing. So we would always suggest that they discuss it with the doctor how much you should have of a supplement. It's fine to combine the supplements, the ones we mentioned, but the dosing should be less, and that exact dose is the doctor decides with the child.
Okay, lovely, thank you. You just actually covered this one. So the supplements can be taken at the same time, they don't need to be taken individually?
No, but we would suggest introducing it one at a time, because if you did get side effects, it would be clearer which is causing it and how to adapt the dosing or how slowly to go up on the dosing.
Okay, lovely. You also mentioned some devices, but we have had some questions regarding a new TENS machine that has been made available by some pharmacies. Some people are wondering how effective they are, whether you have any information on it and if there is any evidence base for them.
Yeah, the devices they don't all have a lot of evidence that they've published that include trials against placebo for some of these over-the-counter ones. We know that the established devices that got approved, they have good evidence, like the TMS, the VNS, Cephaly, Nerivio, the ones that are available in the US and approved. But this particular new one, I'm not aware of the evidence for it. And for many of the device treatments, the ones that are approved and available over the counter, for example, in the pharmacy, you have to really, I guess you could try it, because we don't have the numbers. Not enough people have tried it and published their information and had it tried against placebo. So the evidence is limited on that one at the moment.
Okay, great. It's really, really interesting to hear. Moving on, someone has asked whether electrolytes or salt water can help migraine.
Yeah, some people have asked about this in the past, and generally it is felt that it's the hydration that helps more than what's in the electrolytes or the salts in the water. It's important to have a balance, obviously, because we are generally healthier if our electrolytes are correct, but you generally get those from diet. For migraine purposes, it's more important that the hydration is adequate. So having fluids, we would recommend, not necessarily the electrolyte content or the salt water content, because that again will vary for each person. And depending on what medicines they're taking, you can have your electrolytes changed.
Okay, lovely, thank you. It's being commented on that supplements are often quite expensive, and they can actually cause gastric issues, the gut-related problems. What are there any particular types of supplements like magnesium that are friendlier to the stomach, and how can you minimize the side effects of gut-related issues when taking supplements?
Yeah, it is a drawback with some of the supplements when you get the GI disturbance, the nausea and tummy discomfort. Generally, taking them slowly makes it easier to tolerate. The general rule with the supplements is to take the ones that are most easily absorbed. So for magnesium, for example, magnesium citrate is one of the formulations that's recommended. And if you are not avoiding all drugs altogether, then it may be possible to take something that protects the stomach, like lansoprazole, for example, that often GPs will offer if you're taking a lot of painkillers. You can get a stomach protector. It may be worth trying that. Or it may be that if you can't get to high enough dose of the supplements, they are expensive and it may not be an option if they cause a lot of tummy problems, because what you don't want to do is to swap one problem for another, because it then keeps you disabled. And also trying one supplement at a time might make it easier to tolerate than combining them at the start.
Okay, lovely, thank you. Also, this is something that's we've been asked a couple of times, and it's whether or not CBD oil can be used, and if it can be used, what would the correct dosage be and the most effective method of using it?
Yeah, CBD oil, it's interesting. We don't have evidence for its effectiveness in migraine. We don't have the evidence that tells us what dose is appropriate, how it can be taken, and for how long, and what side effects there might be. It might be a good option eventually, but we'll have to wait for the studies on that. It's still fairly new.
Okay, perfect, thank you.
Sorry, I will also say, Steph, that it may also be that CBD oil, which many people use to help for sleep, might be indirectly helping if it helps to sleep. And sleep, we know, helps migraine if you get regular sleep. So it may be an option to use like that. But as a migraine preventive, we don't have data.
Okay, so something in the future that may be potential depending on studies, which is really good. Someone's asked whether you have any suggestions for managing the nausea and sickness that you get with the migraine, but without using anti-sickness medications from the GP.
Yeah, that's it's very limiting. Some herbs like ginger, turmeric is recommended. People say they have some benefit against nausea, but I don't know. We haven't, again, looked at large numbers of people using it. It's very limiting if you don't have a tablet option, because the nausea in migraine can be quite debilitating and quite prominent. So we would normally recommend a tablet treatment, but without that, we'd say have some food on the stomach, but during a migraine attack, that's difficult. So just maintaining regular meals in general, so that if a migraine attack comes, also there is something on the stomach that's protective. And having fluids might help, small amounts, small sips, just calms the nausea. Otherwise, herbal teas, people say anecdotally works, but again, we don't have the evidence for how useful they might be.
Okay, lovely, thank you. Another one maybe slightly similar, or whether there are any alternative to drug treatments for aura, so the aura part of the migraine.
Yeah, the aura part of the migraine is a manifestation of migraine as well. So the same treatments that are used for migraines with pain and migraine pain, except the painkiller, the same preventive treatments are offered for people where migraine is prominent. So for medications, it would be the regular preventive medications that a doctor might offer, or again, there's supplements, the devices, those would be useful for the aura part as well, because it's all a part of the same condition.
Okay, great. And just going back to supplements that have been recommended, are they safe to use during pregnancy?
That is, yeah, a lot of them are, you have to get medical advice during pregnancy to take any of the supplements. It's not a given that you can take those doses in pregnancy as well. It may not be safe. So it has to be discussed with the doctor, because in pregnancy as well, there has to be the balance between how troublesome and debilitating the migraine symptoms are. Because on the one hand, the migraine in itself can be harmful through dehydration and stress and pain and distress to the fetus and the mother. And also, when you're thinking of not taking medicines in pregnancy in order to do no harm, then you have to balance which is actually going to do more harm. And then doctors make that decision before prescribing something or even supplements based on the relative harm one might cause.
Okay, lovely, thank you. And this is actually my last question that I have received in advance. And this one is, do you have any suggestions for perimenopausal and vestibular symptoms in someone who is sensitive to medications?
Yeah, so for vestibular symptoms, the non-drug options will include some vestibular exercises, clinics that ear, nose and throat clinics, as well as some otology clinics. That's the clinics that look at ear function and balance. They often offer certain vestibular exercises, and that's obviously non-drug. That's done over a period of time. They might offer cognitive behavioral therapy or a combination of those two. And that can be helpful for the vestibular symptoms. And just to say that the vestibular symptoms will include the dizziness, the balance problems, vertigo, spinning, all of those aspects. And also, to be diagnosed with vestibular migraine, the person needs to be checked that there is no abnormality in how their inner ear functions and that there is no other cause for it. And then when vestibular migraine is diagnosed, they might offer the exercises, and also you can have greater occipital nerve blocks can be quite helpful if wanting to avoid a medicine or a tablet treatment. So, and what that is a combination, a single injection with a combination of some local anesthetic and steroids that only goes around just like the base of the skull where that greater occipital nerve sits. And you get a superficial injection of this combination of medicines that really just acts in that area and travels through the pain system to the brain, where it has the effect of turning down the migraine symptoms. And because the vestibular symptoms is arising out of a migraine problem, it can turn down all of that as well. However, it has a temporary effect. So the benefit may last weeks or months, but typically up to 12 weeks only, although it can be repeated. And actually that is a procedure that's helpful for most types of migraine. Also you mentioned the perimenopausal period. That's when the hormone fluctuations are triggering the attack. So whatever migrainousness is there, it can cause more attacks and make you more sensitive to triggers, for example. So again, procedures like the greater occipital nerve block, which is localized and doesn't expose you to a medication throughout your body, that can be helpful. Also, cognitive behavioral therapy is helpful in that situation. The supplements might be useful. And it may be that if each of these therapies add a little benefit altogether, it might create enough benefit that it makes it a little more tolerable. I appreciate that not everyone will be able to take a drug because of, the other reasons we discussed before, side effects, or the drug simply not being helpful. So often it's a case of combining these other therapies, and nerve block is definitely one to think about, even though it has a little bit of medicines in there. And I should also say that it's also one of the treatments that is used in pregnancy when migraines become troublesome.
Okay, lovely. That's great. So that's the end of the advanced questions. I think we'll be moving over to the ones in the chat box. If you do have any questions that you still want to submit, do please keep sending those through. And Debbie will hopefully start taking over and go through the ones in the chat box in a moment. Thank you.
Yeah, thanks, Steph. Thanks, Ria. We have had quite a few questions come in, so I'll just take them in order and hopefully we'll get through them all. So somebody asks that they said they have long COVID and chronic fatigue syndrome, and they've been suffering for chronic headaches for the past 18 months. They don't get auras, and they want to know if the recommendations would be the same as they are for migraines. Please, Ria.
Yes, that's become the new problem, the headaches and the worsening of migraines after COVID and COVID vaccines for some people as well. The recommendation has been to take the same migraine treatments that you will have been using before. Unfortunately, it means probably taking more medicines because it can go on for several months and be daily. And more frequent, but it may be that in the short term, a treatment is used, a supplement, painkillers in the recommended amounts, trying a device if that is an option. Granted, it's not available easily on the NHS, and just managing the triggers, having regularity in activities, a lot more rest. So all of the same treatments you would otherwise use would be recommended. And the outlook is that it will settle if it's related to COVID and vaccines. It does tend to settle, but we don't yet know how long it takes. For some people, it may be a few extra weeks than for someone who doesn't have migraine, and for others, it may be a few extra months. But all of that information is only now emerging. So yeah, just so the treating with exactly the same migraine treatments is the recommendation at the moment.
Thanks, Ria. And we've had somebody ask how it's best to care for somebody that's having a migraine attack.
I think the person having the migraine attack will probably suggest a good way. In general, someone having a migraine attack wants quiet, very often limited movement. They may want to be left alone to just be quiet, without light, without noise, providing them with a cold pack or heat if needed. Some people prefer to be left to sleep. Sleep can be very helpful during a migraine attack, and for people who don't want to be left alone, maybe just sitting there with them so they know that, you know, they're not alone, and that a reminder that this will end. It's not going to be like this indefinitely. In general, if you were taking a treatment, using it like a painkiller, using it as early as possible with some anti-sickness is helpful. Keeping hydrated is still useful during a migraine attack as well, but it may be that all they can tolerate is small sips regularly. That's very helpful. And we know that, for example, when people suffer with long migraine attacks and end up going to the emergency room, the most helpful treatment is probably the fluids and the hydration they receive, because of how limited you are in keeping things down and with nausea. So if it is possible to have sips before it gets to a worsened stage, that might be useful.
Thank you, that's really good to know. So we've had somebody say that they're getting ocular migraines and asking what the best treatment is for these. They sometimes don't have any pain, just loss of vision.
So with most types of migraine, including, I think, ocular migraine is where the pain and the symptoms are focused in the eye. I would say that the treatment would be the same as for any type of migraine, preventive wise, and even for painkillers. So, but what you'd want to check is that there is no other cause for the pain and the symptoms in the eye. So having it checked with the doctor before treating it as migraine is useful, because some other conditions could mimic that, those aura symptoms and pain in the eye. So, and if it is migraine, then treating with, again, the supplements, painkillers, if that's an option, rest, and trying to avoid triggers where possible.
Lovely, thank you. And just on a theme that we were on earlier about breastfeeding, or for pregnant women, are the dietary supplements that you mentioned, are they okay for pregnant women or ladies that are breastfeeding?
I think in general, pregnancy and breastfeeding, the treatments can be similar. So it's best to avoid medications as much as possible in breastfeeding as well. However, with the supplements, again, even during breastfeeding, it's worth checking with the doctor. It's probably less crucial to avoid it in breastfeeding as it is in pregnancy, but it's better to check with the doctor, because there are times when there might be other issues going on, medical conditions, and the dosing may be a little bit high, because it's quite a high dose of those supplements we recommend. So I would say have the same caution as you would with a painkiller during breastfeeding.
Lovely, thank you. And somebody's asking about Botox and whether it improves migraines.
Yeah, well, yes, is the short answer. For about 60% of people who have Botox for chronic migraine, which is the recommendation in the NHS, having Botox can reduce the severity and how many attacks you have, or so the number of headache days and migraine days can be reduced with Botox. It tends to only last 3 months at a time, so it's a treatment that needs to be repeated, and it's offered to people who have had at least 3 preventive treatments already, which have not been effective or not tolerated, and you tend to get offered 2 sets of Botox treatments 3 months apart, and at the end of the second treatment, they assess the effect to see whether it's worth having the 31 injections you get via this specific protocol. So it's definitely a useful treatment for chronic migraine. We don't use it for episodic at the moment. It's not approved for that reason. But you'd have to be able to tolerate 31 injections, but they really are quite superficial injections. most people say they find it a lot easier than they were anticipating.
Lovely, thank you. So somebody has a migraine and vestibular issues, which have been checked but never been given an actual diagnosis. What she is saying that maybe they think that she has health anxiety. Would you have any recommendations as to what they should do?
So I think if there is a question that it might be vestibular migraine, then the implication is that there are attacks that come with a lot of vertigo, a lot of dizziness, some balance problems. The advice is always to check that there is nothing abnormal in the functioning of the inner ear. And often then the treatment, as we briefly mentioned before, would be possibly some vestibular exercises, which can help to reduce those symptoms, and regular migraine preventives. So on the medication side of things, you can use any of the recommended preventives like the propranolols, the lamotrigine, for some people valproate, topiramate, flunarizine in some cases. So these are all medications that the neurologist or your GP might recommend for vestibular migraines, same as for other types of migraine. For some people, the dizziness can be troublesome. They also can have something called prochlorperazine, which some of the ENT clinics tend to offer. What we suggest is that people who have a lot of those symptoms, but also have a lot of this sinus type symptoms, to not have procedures until you get the diagnosis right, because oftentimes you can have various types of washouts and things that make no difference to the migraine symptoms. And with migraine, you get a lot of activation in the face, around the front of the face, and it's just a part of the migraine. There isn't anything necessarily wrong with the sinuses that need any procedures. So getting the diagnosis right is super important. So for this person who thinks it might be vestibular migraine, I would say they should have the diagnosis clarified. And if the GP isn't clear, then they can be referred to a neurologist to get the diagnosis right. And then the neurologist may also offer a wider range of preventive treatments, some of which the GP won't have access to.
That's really useful. Thank you, Ria. So we have somebody asking a question about managing menstrual-related migraines. They tend to start 3 days before the start of the cycle, lasting throughout, and then for 3 days afterwards as well. They've experienced severe side effects from prescribed preventative medication, and it's proving to be ineffective. They get significant aura, loss of feeling on one side of the body, and can suffer complete loss of vision. So any alternatives would be appreciated. Thank you, Ria.
Yes, for these attacks can be quite long, and for people who have those attacks just around the period and just before, where it's very predictable, on the medication side, I would mention first, one of the triptans, frovatriptan, for example, it can be used to treat for those predictable attacks over several days, up to 4 to 6 days even. But then you can't take a triptan on more than 10 days per month, so they'll be limited. And if so, a non-drug option might, well, I was going to suggest some people also have estrogen gel patches around that time, because the migraine is usually triggered by a sudden drop in estrogen at that time of the month, and having the estrogen gel just for that period might help to prevent that attack. Estrogen in that situation will be a treatment, but it's on the skin and it may be easier to tolerate. So it may be an option for some people. I would also think about maybe the greater occipital nerve block as an option. The supplements might be helpful. So again, this yeah, similar sorts of treatments, non-drug options might be helpful for those with the aura symptoms. Again, that's driven by the whole underlying migraine process. So if you address the migraine as a whole and try to prevent and limit the attacks, then the auras should be less, the severity should be lower. Even if these treatments don't, the non-drug treatments don't eliminate them completely, they might shorten them as well, which makes it slightly more bearable.
Sorry, I just realised I was on mute. We have somebody asking if there's any evidence of cold open water swimming to help migraines. That's
interesting. I don't know if there's evidence of cold water swimming. I don't know how many people do it routinely. I mean, we know that cold helps, just having cold packs, for example, on painful areas. I don't know whether it's the same mechanism that helps. We know exercise can help because it releases endorphins. So whether the combination of those two things is helpful, it's possible, but I don't know what the evidence is specifically for cold water swimming. Sounds interesting though.
It does indeed. Are there any foods that can help reduce migraine and those any that could increase attacks?
Yeah, the food is an interesting area with migraines because generally we want to keep blood sugar levels stable. So eating regularly is recommended. When you break down types of food, you also wonder whether it's the type of food that might be causing migraine or triggering migraine, or whether it's a part of the process that you were craving the food. So far, the only evidence we have is that foods containing nitrates, for example, like MSG, and certain aged cheeses have compounds that can trigger migraine. Everything else, there isn't really, and certain red wine, sorry. For the other foods, there isn't any clear evidence that they trigger migraine, but we do know that at the beginning of a migraine attack, for 24 hours or so before, a lot of people get certain food cravings. We know that sometimes they have that food, and the attack that was coming anyway arrives, or the pain phase arrives, and then you wonder, was it consuming that food 24 hours earlier, or was it coming in, and was it coming anyway and therefore wasn't triggered by the food? We think of it more as a premonitory symptom or a prodrome feature where certain foods are craved and eaten and has absolutely no impact on the attack, which was coming anyway. But there are some people who can be very specific that on separate occasions they have had certain foods that were a trigger, and that's possible as well. There just isn't yet the evidence for these other foods causing or triggering migraine.
Okay, lovely, thank you. I think that is all the questions that we have. There's some really useful chat going on between everybody, so it's really nice to see everybody sharing hints and tips. We have, sorry, we've just had one more come in. Insomniac and have anxiety, CBT only work to a point. They have a fear of medication, really struggling to manage any of the above. Any advice on how I can manage it, please?
So how they can manage sleep?
Yes.
Yeah, okay. Yeah, sleep is, it's really, really important to look at sleep, because it can be both helpful to avoid migraines, and sometimes it's the migraines that are causing the sleep problems. So it's really important to just do what we can to get regular sleep. So in general, the non-drug options tend to be staying away from screens about an hour before going to sleep, going to bed at regular times, waking up at regular times. It's been suggested that we should focus on the waking up at regular times, and that will feed into the time you go to bed, because if you wake up at a set time, you tend to get tired and ready for sleep at set times in the evening. It's been suggested that having a cool room makes it easier to sleep in, having warm baths before bed, not having alcohol or caffeine close to bedtime. And these things can all help to make sleep easier. Controlling pain can also obviously disrupt sleep. So controlling migraine in other ways, you know, supplements or whatever other treatments. And minimizing stress, because often it's difficult to fall asleep if there's a lot of stressful events happening. So, or waking up in the middle of the night and unable to maintain sleep. There's the other issue about sleep apnea. For some people are affected by that, and where you have breathing problems and there's a lot of snoring with that, and that can disrupt sleep. So getting that treated, if it were an issue, would also be helpful. And those are the main non-drug treatments I can think of. Obviously, staying away from sleeping tablets is a good thing because they can create dependency. And yeah, so CBT is actually seen as helpful, but I appreciate it's probably only helpful to a point if the problems are more severe.
Lovely. Thank you so much, Ria. We are just about out of time, and I think we have taken all of the questions. Apologies if I've missed any. They were coming through thick and fast. So like I said at the beginning, if you do have any additional questions, please do email us afterwards and we'll put them to Ria.